Hi, this is Erica Williams, and I'm going to present the Rivermead Behavioral Memory Test, 3rd edition. The purpose of this test is to predict memory problems and monitor change over time in individuals with non-progressive brain injury. Its purpose is also to assess the memory abilities of adults with other diagnoses to find out the severity of their impairment, the client's strengths and weaknesses for the purpose of intervention planning, and the effects of interventions. In a separate file, I have provided you with the directions for administration and scoring from the manual. You may want to have this handy as we go through the assessment so you can see the instructions you are to give the client verbatim. The Rivermead comes with 2 stimulus books with different versions to allow for retesting, but today we're only going to go over version 1 for the sake of time. The Rivermead takes 30 minutes to administer in full and should be administered in its entirety in one session. However, if needed, the client can take a short break and complete testing afterward. This tool contains 14 types of subtests, but 19 subtests in all. The first subtest is the first and second names presentation. The examinee is shown 2 photographic portraits from Stimulus Book version 1 and asked to remember the first and second names of the people in each photograph. The second subtest is the belongings presentation. 2 possessions belonging to the examinee are borrowed and hidden in a desk drawer or a cupboard, closet, or suitable alternative. The examinee is requested to ask for the belongings at the end of the test session and to remember where they have been hidden. The possessions should not be valuable. The third subtest is the appointments presentation. An alarm is set for 25 minutes time. The examinee is required to ask 2 questions related to the near future when the alarm sounds. You say, I am going to set this alarm in 25 minutes time. When it rings, I want you to ask me 2 questions. When do I have to see you again? And when does the session end? When the alarm sounds, try to remember to ask both questions. The fourth subtest is picture recognition presentation. 15 line drawings of common objects are shown from Stimulus Book version 1, one at a time for 3 seconds each. The examinee is required to name each picture and later to select the original 15 from a set of 30. If the examinee incorrectly names an object, give the correct name and make a note that the examinee may have word-finding problems or perceptual difficulties. The fifth subtest is the story immediate recall. The examinee is asked to listen to a short passage of prose being read out and is then required to recall as much of it as possible. The examinee is later asked to recall the story again without a second reading. Write down the examinee's responses verbatim on the record form or reproducible story card provided. A voice audio recorder can be used to record their answer if you find this helpful. The story that is read out loud to the client is shown above, along with the subsequent questions you should ask them. The sixth subtest is the picture recognition, delayed recognition. The pictures shown earlier are presented again with distractors. You say to the client, a few minutes ago I showed you some pictures. Now I am going to show you some more pictures. I want you to say yes if you saw the picture a few minutes ago and no if you didn't. Present the pictures one at a time and say to the client, did you see this before or not? Encourage the examinee to guess if she or he is not sure. The seventh subtest is a face recognition presentation. The examinee is shown pictures of 15 faces from the Stimulus Book version 1, one at a time for 3 seconds each. Later, the examinee is required to select the original 15 from a set of 30. Say to the client, now I am going to show you some faces. For each face, I want you to tell me if it is a man or a woman and if the person is under or over 40. This is just to help you concentrate because later on I am going to show you some more faces and I want you to pick out the ones you have already seen. The eighth subtest is the route immediate recall. The examiner traces a short route within the room. The route is comprised of 6 sections. The examinee is required to retrace the route immediately. Instructions should be adapted to suit the room in which the test is being conducted. The important specification is that the route has 6 sections, including 2 chairs, a table, a window, and a door. A message and a book are left at 2 of the locations. You say to the client, "What I'm going to do now is trace a path around this room. I want you to watch what I do, and when I have finished, do the same thing. I'm going to start from this bench and take this message envelope and this book with me." The envelope is marked "Message," and the book can be any book available to the examiner. Show the envelope and the book to the examinee. Say to the client, "From here I am going to the door, and from here to this chair. I am going to leave this message on the chair. From here I am going to the other chair, and then to the table, where I will leave the book. Finally, I am going to the window, and this is where I finish." Fetch the message envelope and the book and return to the original starting place somewhere in front of the examinee. And say to them, "Now what I would like you to do is start where I started and do what I did." The 9th subtest is called Messages Immediate Recall and is closely related to the previous subtest. If the examinee does not pick up the book and envelope, the examiner then prompts them to do so. Record whether the examinee picks up the message envelope and the book and leaves them at the correct places. In the event of the examinee failing to pick up one or both items, stop the examinee and say, "I took 2 things with me. Do you remember what they were?" If the examinee does not remember, add, "It was this message envelope and this book. Do you remember what I did with them?" The 10th subtest is a face recognition, delayed recognition test. The examinee is required to recognize the original 15 faces from a set of 30, including the 15 originals and 15 distractors. Use Stimulus Book version 1. Say to the client, "Now we are going back to those faces I showed you earlier. For each face, I want you to tell me whether or not you saw this face a few minutes ago." Then present the 30 faces in the stimulus book one at a time. The examinee is required to say yes or no depending on whether or not the face was shown earlier. Presentation is unpaced. Encourage the examinee to guess if he or she is unsure. Subtest number 11 is orientation and date. The examinee is asked 13 questions relating to orientation to person, place, and time. The 12th subtest is a novel task, immediate recall. The examinee uses the different colored pieces to make up a star inside a template. Demonstrate how the pieces can be positioned to form the star using a set order. The examinee then attempts the task. This whole procedure is repeated twice more. Start with the 6 pieces laid out above the template in descending order of size. The 13th subtest is the appointments, delayed recall. Engage the examinee in conversation until the alarm sounds. When the alarm rings, the examinee should ask you the 2 questions specified earlier. The 14th subtest is the story, delayed recall. After testing recall of the appointments in the previous subtest, ask the examinee to recall the prose passage. Subtest 15 is called Route, Delayed Recall. The examinee is required to retrace the original route. The 16th subtest is the Messages Delayed Recall. If the examinee does not pick up the book and envelope, the examiner then prompts them to do so. The 17th subtest is a novel task, delayed recall. After a delay, the examinee tries to remember the order in which to place the given pieces to make up a star using a template, this time without any demonstration. The 18th subtest is the first and second names, delayed recall. Represent the original 2 portrait photographs one at a time. Provide prompts if necessary. The 19th and final subtest is the belongings delayed recall. The examinee is supposed to ask where 2 of their belongings are hidden when the examiner says, "We have finished the test." I administered this test to a client and filled out a record form, which you can view in a separate file. The scoring manual can be used as a reference to review how the scores were reached.